Good afternoon. My name is Dawn Hicks, and I'm going to be speaking to you on the subject of universal pre-K and how it can be instrumental in bridging the gap between diversity and leveling the playing field for many children of socioeconomic status upon their entrance into kindergarten. The movement referred to as universal pre-K is a high-quality preschool education program funded by the state, backed by the government, with guidelines for centers to offer childhood education to all qualified 4-year-old children where income is not a mitigating factor, or 3-year-old children if from low-income families. Some may not see the importance of this program due to the statement that says there's enough funding for every child who wants to attend pre-K, they can do so. However, I must ask, are they of high quality? And are those programs equally diverse? In the 21st century, it's imperative that we begin to level the playing field for all children, no matter their race or socioeconomic status, at the earliest time of a child's life, which is prior to kindergarten. As advocates, we believe universal pre-K has the potential to create the nation's premier preschool education system. President Obama suggests that by creating universal pre-K for all children, not based on income, will create more funding for Head Start and allow for more at-risk children to be reached sooner. He states that for every $1 spent on universal preschool, we can yield $10 long term. He goes on to state that savings would result in improved test scores and reduced dependency on government programs. Once those children enter kindergarten, they will be prepared. They'd be achieving academically with strong foundations for reading, increased chances for earning their high school diploma, reduced repeating of grades or being placed on special education classes, lowering delinquency and crime are all benefits of universal pre-K. By adopting a universal pre-K system, we would move from the perception that high-quality education is a luxury afforded only to those who are affluent. Instead, we would connect with the community and increase public awareness that early childhood education is a right as well as a necessity to the developing of children once they are born. Economic segregation in preschool classes throughout the country is a problem. Years of research show that poor children do much better academically in economically mixed classes than they do if they attend class only with other poor children. Research also shows that affluent children are not harmed academically by going to school with other poor children. Today we come together with united voices with the purpose of reaching out to policymakers to create a future policy that generates additional funding that would equally benefit everyone in the state throughout the United States for the purpose of creating a culturally diverse school system open to every 4-year-old, no matter of color, culture, or socioeconomic status. It is my request that today we begin gathering signatures on this petition in order to present to our policymakers that will invoke them to action for change that we discussed as far as creating funding for our universal pre-K program. Currently, we have few states that actually operate a full universal pre-K system that's open to 4-year-olds. And they are Florida, Georgia, West Virginia, Illinois, New York, Iowa, and Oklahoma. A few other states also have programs in place that benefit early childhood education. There are more, but today I'm just going to share these 4. Massachusetts, who doubled their investment in their pre-K program for the 2013-2014 fiscal year in order to reduce their wait list for children that's trying to get spots in programs. A number that has been reached is nearly 15,000 children. In South Carolina, they increased its funding by almost 80% in order to extend early childhood education programs to 17 additional school districts in their state. In Minnesota, they're now offering scholarships for preschool-age children whose family's income is low enough to qualify. Those scholarships for private programs are in addition to their Head Start program that they already have available. And lastly, New Mexico's Republican Governor Susana Martinez signed a bill last spring that says they're going to use the money from the state's tobacco settlement to fund early child care and educational programs there. The challenge that diversity has in pre-K classrooms, according to Lieberman, author of A Better Start, Why Classroom Diversity Matters in Early Childhood Education, brings to the attention that the lack of racial socioeconomic diversity in programs serving infants, toddlers, and pre-kindergartens. Early education data states Hispanic children, as well as children from families of low economic status, are less likely to be enrolled in center-based programs, which tend to be of higher quality than home-based sites. And children from low-income families generally are more likely to attend low-quality programming, whether they are center-based or home-based. When determining if preschool or pre-K is beneficial, we know it can be for disadvantaged children. However, that's only if it's of high quality. With the expansion efforts on New York City's current universal pre-K program, in part is due to the government's preschool development grant and their early learning grants. We want to take a closer look at what has worked and what's not working. We can learn lessons about how to implement high-quality universal pre-K, and then ask, can we use these pre-K programs to be expanded? What is the criteria? How to do it successfully? Which policies are needed to support high quality? How can policymakers ensure that families of all backgrounds benefit from universal pre-K? These are all questions that need to be asked when reviewing your programming. What do we know about public funding? For early care and education, public funding barely reaches half of young children in poverty at age 4. percentage is much less for 3-year-olds and under, and children from middle-income families receive even less public funding, and those above the poverty line but below the median income have the lowest rates of enrollment in public-private programs. And that is just because they cannot afford to go. Not only is access very limited, but also who has access to the high-quality early learning programs based on where the children live, as well as other eligibility requirements. From improving public financing for early learning programs, Barnett and Hustis suggest developing new and more reliable funding streams for early learning programs that increase a total amount of public funding available at the very least. They produce full coverage for disadvantaged children. Provide Head Start, child care, and early programming with regulatory relief to facilitate, coordinate, and collaborate across and educational programs receiving federal and state funds. Strengthen states' early learning council. Fund federally early learning challenge grants to states for initiatives that support coordination and increase progress effectiveness. Conduct a public review of Head Start, state of pre-K, and other policies that streamline regulations in order to work with a coordinated, effective fashion at the state and community level. We're focusing on more performance and outcomes and less on monitoring compliance with detailed regulations. Tie federal and state subsidies for all child care quality. States that do not have funds for early education through their school funding formulas should work towards the goal of developing other dedicated funding mechanisms. Early childhood finance reform should be a part of the broader set of policies to increase collaboration and cooperation across agencies for children from birth to 8 years old to improve their effectiveness. As of 2009 to 2010 school year, all but 10 states provide some sort of publicly funded preschool education program. Together, they are the largest public investment in young children not connected to federal programs, even though some states' programs are really small. Providers of pre-K services follow state-specific standards and operate in many settings, including public schools, as well as private schools, Head Start, faith-based settings, and family child care providers. All state pre-K programs are voluntary. In conclusion, we need to do more to help the disadvantaged children. They require special attention and special support through Title I, Head Start, and other programs that focus on poor children. However, all children, regardless of their economic status, deserve support. The beauty of universal pre-K is that the benefit is there for everyone while helping disadvantaged children the most. Thank you. Good afternoon.